Hi, everybody. Thank you so much, Abhishek. Can you hear me? Thank you, Abhishek, and also Dattatreya and everybody else. And thank you to my colleagues. Dr. Kupala and Dr. Katula and I went to the same medical school. So it's always nice to see. And thank you, Dr. Idara, for introducing. So just what I wanted to say is I was going to kind of talk about why it's so important. Like, we had all the experts talking about clinical issues, but I'm just going to take it a different path to public health. I qualified as a physician, but I was always interested in public health, and that's my passion. And I've been doing it for 25 years. Yes, I do precept students clinically. I have worked as a clinician, but public health fascinates me. Next slide, please, because we can, I think somebody's doing this slide. Yeah. So I have no conflict of interest except that I have a family. And also, I just want to say I'm so proud of all of you for everything you're doing. And I think, as one of the esteemed speakers mentioned before me, I was thinking when I was a medical student, I wasn't even doing 1/100th of what you were doing. So, really, kudos to you. So, very basically, in my presentation today, I'm going to talk about, you talked about UN SDGs. Now, I was actually present when the MDGs moved over to the SDGs. And let me tell you, as NGOs, including a lot of young people, we work to put mental health. So when we are looking at the SDG 3 of this, you can see that good health and well-being for all at all ages. We pulled in mental health too. Let me tell you, it was a lot of work, but it's worth it. And also, why are we talking about globalization? Because we are such a global society. There are no borders. So what happens in India will affect somebody else. What happens in the US affects somebody else. So we need to be aware of a few things which really will help us address these. And why is research important? No, there are different kinds of research. There's bench research, which a lot of us physicians do. There is clinical research, clinical trials, which a lot of physicians do. But there is also population/public health research, which you talk about different aspects. Next slide, please, Abhishek. So, very briefly, this is what is important when we are looking at global health research, especially for you. Community partnership, you're doing it beautifully. You're talking, to API, to other organizations. You spread your roots like a big banyan tree. You're in other countries. And interestingly, I'm in Georgia on Tuesday talking to some medical students, and I'll be meeting some Indian medical students there. So I'm excited about that. But based on what everything you're doing, and Abhishek and your team, I congratulate all of you because you're putting healthcare as a human right. Because healthcare is not a luxury, folks. It's a human right. It doesn't matter which country you're in, which administration is there, but we should never forget as physicians that we are talking about them not to make money, not to, make millions, but to improve the lives of people. So equity is crucial, and that's what you're focusing on. Like your Suraksha project, and Abhishek, we had a conversation. I'm going to give you a donation. Like my sister and I talked in memory of our mother, give you a donation to continue the Suraksha project. So one of the things I want to talk about is digitalization. How do you use digitalization? This is what you're doing by communicating. Yes, we have AI. I'm not going into that because I'm working a lot in AI and femtech nowadays. But one of the things I want to tell you is KIS, folks, that is keep it simple. You need to keep it simple when you get the message across. So communication is very, very crucial. So can we move on? So, as you know, SDG 3, the reason I bring up SDG 3 is I refer to a banyan tree. That's what it is. It's encompassing everything. But also, the importance of SDGs, I can tell you, having worked in this field for more than two and a half decades, is it's the interconnectedness. That's why it's so important that we also have the social determinants of health. And I did have some conversations with Sir Michael Marmot of the UK, who actually was tasked with the whole job of creating the SDGs with linking it to the social determinants in the WHO. Next slide, please. So, as we know, social determinants of health, this is what I want to focus on. Based on what my colleague said, is they're crucial in global health research because they influence the health outcomes and disparities. So, what is SDH, social determinants of health? It's where you live, it's your gender, your health literacy, your understanding, and also what is your access to healthcare. And as women, I'm not saying it because I'm a woman or the mother of a daughter, but unfortunately, in many societies, women are at the bottom of the rung. And in so many places I have worked, they cannot take their own decisions. Even in India, in some parts, this is the same. Next slide. So that's why it's so important we address social determinants. So as future medical professionals and young professionals, you will definitely encounter the profound impact because India is so globalized now. It's not the same as me and my esteemed colleagues here grew up because you need to look at the cultural factor. Let me tell you, food, and Dr. Khatula was talking about lifestyle. Food is a big part of culture, and it's so important to talk to them is what is healthy, what isn't. I'll give you an example. When I was in Coney Island many years ago, we had a Bangladeshi woman who came. She just had a baby, and then the baby was brought in because the baby was having, greenish stools. Now, when tested for jaundice, the baby did not have neonatal jaundice. Long story short, we got an interpreter, we spoke to somebody, and luckily her mother-in-law could understand a little Hindi, so I was able to speak to her. Guess what? She was taking copious amounts of a lactogog, that is to increase breast production, with some herbal paste. So it was so, we told her, we can tell her, oh my God, you're stupid, you're idiotic, you don't do things like that. So it's the way we communicate. So we told her, maybe this is not agreeing with the baby. The reason I tell you this is look at the culture, and we need to be treated the same as they need to be treated. So even we learn from patients, we learn from students. Every day we are learning. Next slide. So this is what I want to tell you. This is what I've been teaching my medical students and my public health students is ADDIE. It's not the name. It's not a fancy girl's name, but it is to analyze, design, development, implement, and evaluation. So this is very important. It has to be cross-disciplinary, folks, and you need to have the component of evaluation and monitoring built into your research, even though it's population research. And cultural competency, as I told you, and KISS, and ethical considerations. This is something very important. We have all this for clinical research, but you need to also focus on this in population research and in all your public health projects. Next slide. So this is what I put it very briefly in a pictorial form. So you need to do a needs assessment before you start, even your Suraksha project. I'm sure you're having a needs assessment, but it needs to be specific. So there needs to be two kinds of needs assessment, one which is general, one specific, because it depends on the community, the age group you're serving. And let me tell you something, even older women, they think just because they don't have, their reproductive age is over. I'm not talking about surrogacy or IVF. I'm just focusing on the traditional definition of women in the reproductive age. After they get menopause or perimenopausal, they think they don't need contraception. Bingo. Sometimes they don't even come for their pap smears regularly. They have cervical cancer or precancerous, dysplasia. So what I'm trying to tell you is when you're talking to them, your communication needs to be age focused and how you're going to implement it. And you need community partners because you can't go and say, oh, I'm this physician, I'm from Games, and I'm working with API, and I'm working with all these people. You listen to me. No, you need to come to middle ground. I have found that in my research, working for so long, I feel like a dinosaur sometimes, with all the work we've all been doing. But this is what I tell my students. Next slide. So think locally. So this is what I wanted to talk about, to share some personal experiences. So I am here with the First Lady of Suriname, and they reached out to me, and I would suggest all of you to go onto this UN website saying he for she. Sign up because this is a big campaign launched by the former Secretary General Ban Ki-moon. Some of us were privileged to be at the launch, where this was actually because of one of my former colleagues in the UN, Ambassador Henry MacDonald of Suriname. He and I, we all worked together, and he was the one who started talking about how men should work with women to end gender-based violence because that's a pandemic. Long story short, that's how he connected me to the First Lady of Suriname. The girls didn't go to school because they didn't have pads. So with my medical students and AMBA, American Medical Women's Association, we've been around for 109 years. I'm not 109, but I'm just telling you, we have a lot of students and they all collected funds and we raised funds and we sent these reusable sanitary pads working with Days for Girls to them. So this really helped them to go to school. So you see, whatever I do, I always involve students. I've written 5 books. I'm working on my 6th. 2 of my books, which were textbooks, had students' involvement. So this is the thing. It's research. It's also for writing. You understand, you work with somebody. And you know what? If somebody says, nahi, 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 main kuch nahi karungi aapke saath, you say no. My rule is, how many times can you be pushed away? If you don't have a seat at the table, bring a chair. If there's no room for a chair, bring a stool. If there's no room for a stool, stand up. They'll ignore you once, they'll ignore you 5 times. After that, they'll get fed up of ignoring you. They will recognize your persistence. That's what you need to do. You need to be politely persistent. And this was a project we did with the First Lady of Bahamas, as you can see, a climate change, because I'm big into climate too. And if you can see here, this is the First Lady, and this is with one of my friends, Jing. So we collected funds. We got a grant actually from the private sector. That's somebody else you can reach out to. So we could get these buckets, which has a lid, because Bahamas is very much hit by these storms. So guess what? They have a blanket, which can help a woman when she has a period, or somebody cover them up. It's washable. A little recyclable pillow, which is good for children, thermometer soap. Why do we have a lid on the bucket? Because as you know, when women carry, sometimes there are no lids. And it also works as a stool. So this, we were able to send 1,250 buckets to them, and 1,250 buckets to St. Jude Cancer and Research Hospital. Because we thought locally with a global impact. So what you're doing now with your Gains chapter, what you're doing locally with your Suraksha and other projects, you can translate globally, which you're already in 3 countries. And I hope you get to 30 countries soon. So next slide, please. Okay, so this is all my students in action. A couple of years ago, you can see we did the Safe Motherhood Project with Malawi. These are my medical students, and that was the former First Lady of Malawi to the UN. That is, her husband was the ambassador. And you know what we did? We told students to give up their coffee for a day. So that money, and then they had bar nights. I'm not encouraging you all to drink, but students, when they had bar nights, they talked to the local bar owners. Instead of getting them money, paying money, that money they donated to the Safe Motherhood Kits. So you can see these are all the kits here. And this was cross-disciplinary across my medical students, public health students, and some basic health students. I've done so many projects, but in the interest of time, this is something I wanted to share, because guess what? The students worked, we raised money, we built a maternity waiting home in Malawi because it's very hilly. People cannot walk long distances. They had to go up and down. And also we sent these Safe Motherhood Kits. Next slide. Okay, and so this, again, how I have students working with me. So Radip, one of my medical students, he was a good poet. Now he's an attending. We are in touch. And I write poetry. So I wrote this. And so he created this logo based on SDG 5, which was to improve maternal health. So in the colors of the Malawi flag. The reason I'm saying this was a big seller for us because we showed it to everybody from where we raised funds. So I'm just telling you, these kind of innovative things kids. Not to say that this is what I'm doing or they did, but just as examples which you can just take and share. Next slide. Yeah, and so this is global health in practice. So these are the distribution of the safe motherhood kits. You can see this is the First Lady of Malawi, former First Lady, and these are the kits which we sent. So she's distributing them in Lilongwe. That is the capital of Malawi in the suburbs. And this one, I don't know why that caption went off. My apologies. Well, technology sometimes has a mind of its own, but you improvise. So I was in Kosovo. I was invited to give a talk in Kosovo. I was the only American invited. And this is with the Prime Minister. And the reason I have that because he came to me to speak to me, and he said he is such a big proponent of public health. And the Kosovo Institute of Public Health, they have medical students from there who go, or public health students who go and intern with them. And in spite of all the wars and everything in the Balkans, this is the oldest public health institute. And the reason I have this here, not to show off that I met these people, but just to say how it's so important for people in power to understand the importance of population health, of medicine, of how, because it has to be a seamless blend, the practice of clinical medicine and public health. That's what a lot of us, my colleagues who are basically clinicians, but who are bitten by the bug of population health and public health like me, this is what we do. We try to convince them at all levels. Next slide, please. So as we're wrapping up, yeah, so I just want to tell you, I'm sure you're aware, World Federation of Medical Education plays a crucial role. You know that in also creating curricula because they sometimes do reach out to some of us. Next slide, please. And also the WHO. I mean, some of the students I have seen at the WHO assemblies, so they also talk about what is going on. Like we have a lot of students, you have the student assembly, but this is something because it also talks about activism. Because when you want to do global health, you need to be an activist. You should not be militant, but you need to be a polite activist, but stand your ground. I mean, people tell me, okay, because I tell them very politely, I'm sorry, I don't believe in what you do. If anybody asks me about any political situation in the country I'm living, as an American, or anyway, I say I don't comment on politics. But if I have the opportunity, like I was at the Indian consulate 3 days ago, we were invited. So we were talking about how to put science and technology and innovation in improving water in India, which is a major public health issue. So what I want to say, we also have these two, I don't know, Abhishek and, Dattatreya, if you looked at the Asian collaboration, medical education, they do a lot of work as AAMC. And also, we also have the global health brigades, which I have personally mentored a lot of students to go, both my medical students and public health students. So something you would like to be discussing about. And I think we're almost coming to the end. I think somebody's speaking. Can they mute themselves, please? Thank you. Yeah, so basically, conclusion, folks, medical education anywhere should prioritize integrating comprehensive global health perspective. And what I would like to say, have more seminars. You can invite so many people, and I can invite some of my European colleagues. See, that's the best part of being online in cyberspace. One is no carbon footprints. You can organize a global conference. And you know what? I can help you get so many people who just love to come and talk. And if they cannot join, they will even send taped lectures. It is so important. Like we have this global health conference now in Georgia. We have people from 10 countries. Some are coming, some are hybrid. So what I'm trying to say is you have the power of technology, of communication. It's not to say, oh, which movie star's release is hit or flop. That's what I tell my students, or who's going around with whom. Use social media, use, it's called X now, right? LinkedIn, Instagram to promote, reach out and connect. And you know what? Don't be afraid to reach out to people because everybody started as a student. We all find our way. And it's the whole thing is everybody has place under the sun. That's why we all get together and work together. Last slide. So thank you very much because we are talking about global health. I have the slide in different languages. So happy to connect. And Abhishek, you can, anybody wants to connect with me on LinkedIn. I think some people reached out. I'm very happy to, and I'm happy to work with you guys. And as I said, my sister and I are happy to give you some funding for Suraksha for the cervical cancer. And we need to see how else we need to put our thinking caps on another conversation for another day, maybe one-on-one with your team to see how can other people contribute to that. So thank you so much. I really appreciate this opportunity. Proud of you guys. Go for it. Thank you.